Okay, so today what I thought we would look at is bunions. As you can see my foot right here, I have a little bit of bunion. It's not super prominent, but it is there. I'm going to do a treatment for reducing bunions, and today what I thought we would do is I would do some moxibustion. So in this I'm going to use 2 points. One of them is called spleen 2, which is right here, and the other one is spleen 3, which is right here. Okay, so if you've seen my videos before, I'm using a Japanese moxa. So with this, what I'm doing, this is not for you to do at home unless you have training in this, but I'm just going to show you for the sake of it so you know what I'm doing. I'm rolling the moxa wool into little cones like that. These are called rice grain moxa cones, and so it's about the size of a grain of rice. And I'm going to just place that, whoops, I'm going to just place that here, and then I'm going to burn it. So I'm going to get my incense here, and I'm just going to light it up, and we'll get started. So that's the interesting thing about studying medicine from another land, is that it gives you perspective on things that you might not otherwise see. So in Eastern medicine, bunions are called sugar toes. Why are they called sugar toes? Well, so we need to look at where is the bunion happening. It's always the key question whenever we're looking at the body from an Eastern medicine point of view. The question we always ask is, what channels are involved? So right here we have the spleen channel. So as I said, this is spleen 2, this is spleen 3. So the main problem, the sick channel, when a person has a bunion, the main problem is the spleen channel. So what does the spleen channel do? From an Eastern medicine perspective, the view of the spleen is the view is a much broader view on what all of the organs are doing. So in Eastern medicine, the spleen is also dealing with digestion, it's also dealing with blood sugar. When there's a bunion here like this is not very strong, but it's an indication that, you know, blood sugar is something to look at. Now, I've had this since I was a kid. Since I think I remember being about like 13 or 14. I remember my mom mentioning it when I was a little kid. She was trying to make sure I always had the right shoes, you know. But it's more than a shoe problem. It's a blood sugar problem. Now, what I remember about being that age was I would spend any money that I had, I would spend it on buying candy and cookies. I craved sugar like crazy. And so after that period, I guess there were just a few years when I was a teenager where I ate crazy amounts of sugar, and that's when this started. And it never really got any worse. When I got to my late teens, I started to become quite health conscious, and this never progressed. So, you know, there's an interesting, hopefully a helpful story to help you make sense of bunions, because it's not simply about wearing the right shoes. Now, when the blood sugar is imbalanced, people can get bad reactions to sugar. They can either get wild cravings for sugar, like I had, and then when they get their hands on the sugar, they just keep eating. So there's like this addictive quality, you know. And then of course you've got too much blood sugar, diabetic, pre-diabetic. You've got too low blood sugar, the hypoglycemia. Or you've got, you know, people that feel tired after they eat sugar. Some people feel tired after any meal, and that's also a spleen problem. So any sort of unpleasant reaction that tends to happen with eating sugar, we can blame that on the spleen. Now, in the clinic, I've been doing this with acupuncture, and even when I've done other points on the spleen channel, for example, I've done spleen 6 further up the ankle, and you know, people have reported back to me that their bunion has gotten less painful. So isn't that interesting? Because it just goes to show that it is a spleen problem. Anything unusual that happens along a channel, it's not happening at that location, you know, at random. There is a reason for it, and that's why with diagnosis we're always paying attention to where is the problem, where is the pain, where is the anything, where's the numbness, where's the aching, burning, you know. It doesn't just have to be pain, it can be all sorts of unusual sensations, and we pay a lot of attention to that because the body tells a story. Now, a lot of people come in for bunion treatment because at a certain point it starts to get painful, and then what are the options? When you're in enough pain, right? Pain can bring people to their knees. So if people are in enough pain, they've got to find out what their options are. The options are usually medication, some kind of painkiller. You know, often in this case, it's surgery that gets recommended. And generally, people want to do the least invasive thing that they can before going that route. And that is what I recommend, because surgery, especially this one, bunion surgery or any kind of toe surgery, I've just seen where people have had their toes worked on, so like where they've had bone carved down or carved off, you know, and then they've got to put in nuts and bolts and screws to put it all back together. And sometimes people end up in more pain afterwards, you know, months after the surgery. So it's something to be considered, is there can be sometimes those consequences. Not to mention surgery itself is anytime we're opening up the body, there's a massive energy loss, right, that happens. So for that reason, you know, acupuncture, moxibustion here, you can do this at home, not this kind, but the stick kind. I never use the stick. I'm going to show you the stick here. So this is Moxa stick cigar. They call these cigars. So yeah, I have these. I just typically don't use them because the smoke is a bit too much. I don't really enjoy breathing that in. But you know, this is actually called smokeless moxa. So there's a much smokier moxa. You can get quite a lot of heat from this. So yeah, with surgery, you have a lot of energy that gets lost just from the incision, and thankfully they're doing more minimally invasive, my nails are too long for this, minimally invasive surgery now, even for the bunions. So that's good. You'll have less loss of energy. The other thing to consider is that bunions can come back. Why are they coming back? Think about that. The spleen meridian, did the surgeon fix the spleen? No, right? That's not their education, right? So the root of the bunion problem is a spleen weakness, and so that needs to get fixed, or it's possible that the bunion comes back. Now, because these are called sugar toes in Eastern medicine, so we have to also look at, like, you know, what's the root of the blood sugar problem? You know, what's going on there? What's the diet like, right? Like I told you about my diet. Massive sugar cravings. I used to really like those Swedish berry candies. I would buy a giant bag of that and eat that, like half the bag in one sitting, no problem. So, you know, that's how I got this. So yeah, if you have a bunion, I would highly recommend getting your blood sugar looked at. Get some blood sugar tests. Get some home test strips so that you can start measuring on your own. And the reason is that right now, for a few years now anyway, but there is a massive epidemic of pre-diabetes. So people are pre-diabetic and they don't even know that they're pre-diabetic. And then of course, if that's not addressed early, then pre-diabetes develops into diabetes. So that's what I'm saying. There's an epidemic of pre-diabetes. So the blood sugar is high, but not to the point of being diabetic. But it's at a level where they could learn some lifestyle, cutting back on their refined sugar and prevent getting full-blown diabetes. So it's not getting looked at enough, and so many people are falling through the cracks of the system that we have. So that's why I'm here. I try to give people alternatives like this and education so that you all can start taking your health more into your own hands, you know, with guidance, of course, but you know, we've all got to be a little bit more proactive. I'll just do one last one here. There you have it. There is a way to treat bunions that gets more to the root of what's going on, which is an issue with the spleen channel, right? So we want to prevent a bunion from coming back, right? If we get the surgery done and then we don't address the core problem, then, you know, after all, you go through all that surgery, then the bunion comes back, then what are you going to do, right? So might as well get to the root cause, the spleen channel deficiency. Okay, there you have it. And I look forward to connecting with you again in the next video.